It's actually the opposite. If you end single payer public health care, what you are likely to get is access to healthcare, which is what you don't have right now. Not in a good way, not in a timely way, not in a guaranteed way.
Not at
Right
all.
now,
We have a sick
right?
care system, which is one
Right.
way, my way or no way. We saw that during COVID. You didn't get a choice as to what medicine or conversation even you could have with your own doctor as to
Right.
the best uh, service and or products that met your requirements and needs and desires. So I mean, we're seeing this with healthcare, and I think again, Sean Buckley talked about this
Yes.
tremendous detail, which I hope to have Sean on here very quickly, about Health Canada, and it
Yes.
is a monopoly, right? You are being
Yes. Yes.
told and restricted and limited as to what your choices are. And most of them have to do with you being sick, not with
Right.
you trying to pursue health.
Right. But you see, this is not an accident. Anybody could have predicted this. Because look, so we all know about the stories from the Soviet Union about people, lining up for miles and miles when some store gets shoes to sell. Because because the shelves were often bare, and then a store suddenly got shoes to sell, and everybody lined up for shoes because they couldn't get shoes. And why is that? Well, because the government controlled everything, and so there was no supply and demand. There was no private entrepreneurs making shoes. They just weren't allowed to do that.
Well, there was no
And the inevitable is
motivation
there was
to
no
do
reason. There was
that.
no reason, no incentive, no reason to do that. And in fact, the government authorities might have prevented you anyway.